Hey everybody, it's Dr. Nelson. I wanted to chat with you guys a moment on how we help with TMJ and TMD, temporomandibular joint pain and temporomandibular dysfunction. So this is something that often shows up at a dentist's office and can cause tons of pain, clicking, locking, trouble chewing, bruxing, that's the tightening, the clamping down of your teeth at night, which can lead to cracked teeth. It can cause you to need root canals, crowns, all sorts of problem, like grinding. If your coworkers are doing this while they're working, first off, maybe they need some stress management. Second off, they probably need to see me. And third off, they probably also need a great dentist. Look at our Keller Wellness Coalition for a great referral there. But let's come back to this here. So I want to show you a little bit about how we think about the problem and how we're able to help so much. I've had so many patients who came in not able to open their jaw or was locking or clicking on one side or the other, and within several visits were able to make a huge difference, including one of my favorite cases where a lady came in after having had to drink all of her food through a straw for about 3 weeks. She was desperate for relief, and she was able to go home and eat soup off of a spoon that night because she was able to finally open her mouth an extra ½ inch just after that first treatment. It was super awesome. So a lot of people will look at the jaw, they'll look at the joint itself, and they're not wrong, but they're missing the fact that the nervous system is the master system of the body. So what we're looking at here is particularly important are the masseter muscles right over here, some pterygoids in the middle, and then the temporalis muscle, which is why your temples are called what they are. And these all come through right here, right underneath the zygomatic arch, which is a part of your cheekbones right here. They dive down underneath and they tie into the top of your jawbone right here. Now, these are also very commonly go hand in hand with headaches, which pull at the back of the eye, and it hurts like hell. It can make you light sensitive, sound sensitive, mimic a migraine, or cause one, which is very rude, but these things happen. So if this is what's going on here, this is what you need to know. All of these muscles here are regulated by your brainstem, and your brainstem extends down into your spinal canal here, down to your C3. The levels of your nerves that run these muscles that move this joint around and are responsible for locking or not locking are at about your C1 and your C2. So if you have a ton of tension, you have headaches, tightness, maybe you have your shoulders up around your ears like earmuffs all the time, or you answer your phone like you know you're not supposed to, but hey, we all do it every once in a while. You answer your phone like this. This could be part of what's going on here. So the problem is really threefold. There are joints in your neck and joints in your face that are not moving like they're supposed to, okay? That causes a lot of nerve inflammation. That nerve inflammation leads to muscle tightness. Those muscles lock up the joints then don't move properly and tick off the nerves. Now that's quite a to-do. So how do we address this? This is the overarching treatment principles we use in our clinic here, because what we do is we come through and we provide adjustments to help the joints. Yes, we can adjust the TMJ as well as adjusting that upper cervical area here, and then also paying attention to the lower neck, which is very important for blood flow, regulation of panic, stress, anxiety, heart rate, all the things that lead to this. So if that's you walking around, running around, you need to come see me. Okay, cool. Now, the nerves, we provide red light therapy. This has an added benefit of decreasing pain. I'm gonna write P exclamation mark. That's a little shorthand for pain in case you see that in somebody's notes. All right, shining it directly on the jaw and on the temples can help drop pain and make the adjustment of the jaw joint itself so much more comfortable. If you've ever had that done and you had a negative experience, first off, I'm sorry. Second off, I can probably help with that because of how we approach things. Thirdly, we do trigger point releases. So many times we find trigger points, especially up here in the brim on the outside of this temporalis muscle, that are causing the jaw to be pulled back and up, because if your jaw actually released forward, it would pull on this, sending this shooting, stabbing pain into your eye and causing the ruin of your entire day. So what does your body in its wisdom do? It decides, hey, That would hurt like hell. Let's not do it. So then what does it sacrifice? Your jaw motion. So as soon as we release those trigger points, now it's actually freed up to move appropriately. And so we can address this connection, that connection, and this connection, interrupt those all, turn them from an up spiral to a down, and from a down spiral, to an up spiral, help your jaw be able to move better. We're very effective at this. We can tell within about 3 or 4 visits whether or not this is gonna be super effective for you. So if you're curious to learn about other things we can help, everything from headaches to migraines to numbness, tingling, shoulder problems, rib pain, check out the playlist with the other conditions that we can help with. If you know someone who needs to come see me, send them our way. And if that's you, we're looking forward to meeting you. Again, I'm Dr. Nelson. Thanks for watching. We'll see you in the next video.